Okay, so ischemic stroke can be caused by an embolus, which is a clot that has traveled and gotten stuck in the brain. It can be from a PE, it can be from the heart. What condition gives us clots in the heart?
AFib.
AFib, right? So it could be AFib, or it could be DVT. These are the common reasons that you would have a clot somewhere and then it travels, okay? Or you can have a thrombus that is all of the plaque builds up so much that it meets and now there's no blood flow, okay? Or you just develop a clot in one place but it doesn't move. Okay, so that's an ischemic stroke. And there's some other risk factors like smoking, hypertension, that kind of stuff. But basically, bottom line is ischemic stroke, you have a lack of blood flow to part of your brain, and that's causing the problem. So lack of blood flow, and brain cells die. So I've said it's all about perfusion like a million times. This is no different. If you don't have blood flow to part of your brain, it's going to die. And then whatever part of the brain that's dying is what you're going to see in the symptoms. Okay, so if you have a clot on the left side of your brain, remember everything is opposite, then you're going to have right-sided weakness, or you might have some speech issues if that's the part of the brain. If it's an occipital, we know that's vision, so you might have blurred vision, etc. Okay? So that's what causes an ischemic stroke. So signs and symptoms. You're going to think fast. And I know they've added the be fast, but we're just going to do this for now. So you think fast. Okay, so what does the F stand for?
Face.
So facial droop. How do you assess that?
Smile.
Ask them to smile. Yeah, just asking them to smile and then one side doesn't go up. Then they have facial droop. Okay, what is the A? Arm drift. So if you ask them to hold their arms up like this and one of their arms goes like this, you're basically assessing weakness of that side in a very quick way. And then what's the S? Speech, so slurred speech. It could also be word salad. They put all a bunch of words together that don't go together.
Expressive aphasia.
Expressive aphasia, yeah, they can't talk. Or the words coming out are not the words that are in here. And then T? Time.
That's important.
So they used to call it onset of symptoms. Now they're calling it last known well time. It's the same thing. This is perhaps the most important part of your assessment, the last known well time. Why?
Then you know. They make the time, the gap.
The only thing that can potentially cure an ischemic stroke is a thrombolytic, something that will go in and break up a clot. It's the only thing we have. Now, if you're at a major medical center where they're doing the cutting edge stuff, they can go in with a catheter, like in the cath lab, and they can actually suck out that clot, or they can inject a thrombolytic right in it. But that is not the common standard yet, okay? So last known well time is one of the most important things that you have to know before you treat, okay? Okay. So your patient comes in and they've got left-sided weakness and they aren't speaking correctly. There's just a bunch of weird sounds coming out of their mouth. They've got some arm drift. And what is the first thing that's going to happen? They call code stroke. What's the first thing that they're going to do? CT scan. Why? What are they looking for? They're looking for a bleed because you can't see an ischemic stroke on a CT. You can see old strokes, but you can't see the actual ischemic stroke. So what you're ruling out is a bleed. Okay, so what if the patient has a bleed? You can't give TPA. If the patient does not have a bleed, you can work them up for TPA, okay? So we're ruling out a bleed. If they have a bleed, then they have a hemorrhagic stroke, which will be the next thing. But if they do not have a bleed, then we're going to say, okay, they have an ischemic stroke. Let's work them up for TPA. There's 5,000 different criteria that you have to look at to see if they're a candidate, which is not something that you have to memorize because you'll have it right in front of you. But there are some basic things like they just had surgery, they just had a head injury, you know, things that make a lot of sense. That because the thrombolytic is not smart enough to go, I'm going to go to the brain and I'm going to find the clot and I'm going to break it up. It's going to go, ooh, clots, and it's going to break all of your clots. So if you fell and bumped your knee last week and you've got a bruise there, that clot is gone. Every clot in your body that you had will be busted. Okay? Now, that being said, you want to have 2 large bore IVs because you do not want to poke holes in a person once they've had a thrombolytic because they will bleed all over the place nonstop. Okay? So you want to make sure you've got IVs, you've got a Foley if necessary, and if they're going to need an NG tube or whatever the case may be, you're going to put everything in first. And then TPA is just a one-time dose. There's usually like a bolus and then a drip, but it's just like over an hour. It's a one-time dose for an hour, and then we watch. How do we know if the TPA was effective? The symptoms go away. Signs and symptoms improve. What's the biggest risk? That they develop a brain bleed and they die. People with brain bleeds have a very high mortality rate. So, and I'll get to that when I talk about the hemorrhagic stroke. So this is your assessment. Act fast, think fast, okay? Last known well time is one of the most important things that you assess, that you have to know. You cannot give TPA if you do not know what the last known well time was. What if grandma last night after dinner was like, man, my face feels a little funny, or my arm's a little numb, I think it went to sleep, and then she goes to bed and she gets up in the morning and the whole side is flaccid. What was the last known well time? Probably last night, and so she is not a candidate for TPA. And if you're not a candidate for TPA, now it's all about preventing more clots and rehab. Okay, and ischemic strokes are devastating, and they are a life changer, and there's a lot of permanent disability out there, loss of job, loss of wages, loss of your self-esteem, you feel like a burden. I mean, there is a whole host of things that surround an ischemic stroke. And if you've had one stroke, very high percentage that you'll have another one within a year, and then a little bit less of a percentage in the next 5. Once you've cleared 5 years, then you're pretty average as far as your risk factors. Okay? Okay, so that's the diagnostic test. CAT scan, they have to have a CAT scan before you do anything. Okay, last known well time CAT scan if you get nothing else from this. Okay? So treatment, so let's say they don't get TPA. What is the treatment? What did I say our goals are going to be now? Rehab and prevention of clots. So what are they going to be on? We're going to be on anticoagulant, physical therapy. There's a very, very important thing that we need to do. Swallow eval. Do not put anything in that person's mouth until you have a professional swallow eval done by a speech therapist. It's not like a patient that's just been intubated for a few days, they get extubated, and you do your own bedside screening and then identify, do I need a swallow eval or not? This is I'm going to get an official, professional swallow eval before I put anything in that person's mouth. Okay? So this is another one of those, I'll put a star by everything. Okay, so anticoagulant, physical therapy, swallow eval. They might need some OT, which is like fine motor skills. PT is like gross motor, like walking and stuff, and OT is like feeding yourself and tying your shoes and that kind of stuff. Okay? Anything else that I'm missing?
Speech therapy.
Speech therapy.
The swallow eval is just like aspiration or like, I mean, with
Swallow, yes, aspiration is the problem we're trying to prevent, but a lot of times they need a modified diet because they can't swallow like they used to. So they might need their liquids thickened, or they might be on a puree diet, or chopped or soft, or they got all different kinds of mechanical soft, all kinds of different diets.
Since they want the thickener, is that what you're
The
trying to
thicket,
Thicket?
thicket. You can even make your water thicker, like
That's
magic.
that's what I remember. Somebody was
Okay,
doing.
so that is the ischemic stroke. So our overall goal is quality of life. What is the best quality of life for this patient? You know, I'm going to put antidepressant down here too. And also like a community stroke support group, which now, these days, they have a Facebook group, and they'll have a big one and a local one and all that stuff. So our overall goal is best quality of life for that patient and the highest level of self-care. Okay, so that is the ischemic stroke. I'm sorry, I kind of went all over the board, but usually it's like left to right. Okay, any questions about ischemic stroke?